Welcome back, everyone. I'm Dr. Dan Bockmann. I'm a chiropractor in Austin, Texas. I have a rehab clinic here. And today we're going to answer another question from a viewer. And the question today is it possible to reduce knee pain naturally? And I'm assuming by the question you mean without drugs or surgery and fix it yourself, essentially. And of course, your goal is not just to get out of pain now, but keep from having pain in the future, and at the same time allow yourself to have a nice active life. Basically, more active, hurt less. And the short answer is yes, that is absolutely possible. In fact, that's what rehab or physical therapy is using non-invasive tools to fix a joint problem. In this case, we're talking about knee. And we'll just preface this by saying there are many possible causes, many things that can cause knee pain. However, in my office here, the huge majority of those the causes of knee pain in the first place are relatively simple and easy to fix, and they absolutely can be done by you on your own. In fact, I have a whole series of online courses that teach you how to treat your own knee and hip, fix your own knee and hip and back and shoulder pain. But for our purposes today, yes, you can. It is possible to relieve your own knee pain on your own. And the two things to look for, or the two things I look for when I have a patient who comes in with knee pain, are flexibility and strength. Flexibility means how well can my knee move? Can I straighten it all the way? Or is it too painful or too stiff? Can I bend it all the way? Can I pull heel to butt easily and touch heel to butt easily? And if the answer to either of those is no, then that means that there is something stiff that is limiting mobility in your knee and forcing it to move abnormally, which can cause pain. The second side is knee strength, and that means I'll check the patient who comes in and see, are the muscles that attach around the knee, whose job it is to support and protect it, able to do that? And if they can't, that can allow the pain to happen in the first place. So that breaks down to either tight things or weak things as possible causes for knee pain, right? Of those two, tight things are by far the biggest cause for knee pain. Yes, if you're too weak, that can be an issue too, but the huge majority of the time, it's tight things around the knee. Specifically, tight hamstrings, big cause for knee pain. Meaning, if your hamstring muscle, which is a rope, if it's too short or it's too stiff and it's not elastic enough, then it's going to force your knee to move abnormally and can give you the knee pain you're having. IT bands, which are that's a long tendon that runs on the outside of your hip and thigh, attaches to the outside of the knee. If it's another big kind of common offender. Or tight quads as well. Quad is the muscle on the front of your thigh, crosses the knee, attaches just below the knee. Those are all big offenders around knees. So if I had a patient come in and I found, hey, they've got some limited mobility around the knee and hip, then the fix is plug in the fixes that loosen the tight things, and then plug in the fixes that strengthen the weak things, and then we see if their knee pain goes away. And almost always it does. And the good thing is, if those are the true causes, you're going to start seeing results right away, like within a matter of days as you improve that flexibility. So quad stretches, and we don't have time to go into that today, but quad stretches, hamstring stretches, IT band issues are best fixed with foam rolling. Foam rolling is self-massage. Massage is one of those tools that loosens tight things. Those are some of the most immediate fixes. For a more in-depth kind of explanation of how to check yourself out and plug in the fixes for these things, I'll put a link to my knee pain fix program in the description below. Always, if you think there's something seriously wrong with your knee, if you had a big injury, a traumatic event, or your knee pain is worsening, it's always a good idea to go to a doctor first, get them to check you out and make sure you're structurally okay. Make sure you haven't torn or ruptured something in there. It's good to know what's wrong, then the fix becomes more obvious. But in the huge majority of knee pain cases that I see here in my office, the fixes are very straightforward using stretching, massage, and exercise. So I hope this has been helpful. I hope your knee pain ends up being an easy fix. If you have questions that you would like answered, definitely leave them in the comment section below. I'm going to do my best to get to those. As always, hope to see you guys again next time.